So in this video, I'm going to share my experiences of having a clotting disorder while being pregnant. And as you guys can see, I had a pretty successful pregnancy with my 1-month-old. My name is Shaytoya, and I am a mompreneur. How I found out I actually have a blood clotting disorder. So with my first pregnancy at 39 weeks, my doctor actually decided to induce me because I was super swollen, and we thought I had preeclampsia. Blood pressure was very high as well. After I gave birth to my son 2 years ago, I actually got to go home 3 days later to just end up back in the hospital a week later. All we knew at the time when I went back to the hospital that my kidneys were shutting down, so it was super scary. But I ended up finding out I had a blood clot, and it was the worst. It was the worst experience to ever have to deal with. You know, having a newborn at home and having to be stuck in ICU. I would never hope that on anyone would ever have to deal with what I went through. But thank goodness thank goodness we caught it in time and I was safe. Some of the symptoms I had were I was super swollen. I looked like I weighed about 300 pounds, which if you guys can see, I did not weigh 300 pounds after just giving birth. I had really bad back pain and I had trouble breathing. So that's one reason why I went back to the hospital. During my hospital stay, I found out I have factor V and I have one gene, which means it just comes from one family member. And so pregnancy and birth control can actually increase my chances of catching a blood clot. So when my son was 2 years old, I ended up finding out. David, do you want to say hello? Hello. So when my son was 2 years old, I ended up finding out I was pregnant with this little girl right here, which we're super excited about. But at the time, I was super scared. For one, being pregnant, getting pregnant on IUD. I heard about ectopic pregnancies, so I was concerned about that. But thank goodness, as you can see, everything worked out. And then also with my experiences with my first, I didn't know what to expect. Knowing now I do have a blood clot disorder. So I scheduled a doctor's appointment right away as soon as possible, like the next day. Did a lot of research on what doctor I wanted. I actually found a doctor that my cousin had used and wanted to make sure that everything was a lot better this time. Because of my blood clotting disorder, I was actually considered high risk. So I was seen by 2 doctors. I was seen by the doctor that was going to deliver my baby girl, plus my high-risk doctor. As soon as possible, I started taking blood thinners right away. The high-risk doctor would actually do ultrasounds once a week due to the fact that with being on blood thinners, it could actually cause my daughter to be smaller or not to grow. So we wanted to make sure she was growing as much as possible and as developing as she should. You guys can see, thank goodness we had a healthy baby. So they tracked the whole entire pregnancy, and I got an ultrasound once a week. I feel like that's every woman's dream. My fiance Kevin had to give me shots daily, which sucks, but it kept me safe. Once I got further along in my pregnancy, I would actually be monitoring the baby, checking to see the contractions, plus checking her heart rate. And I would sit on that for about 45 minutes, plus seeing my regular doctor. So my doctor actually gave me a choice of being induced at 39 weeks, or I can go to until I delivered, but they were going to change my medication where I would have to get shots twice a day, one time in the morning and one time at night. I decided to be induced since I was induced with my firstborn child. Me deciding to be induced, I would have to, before, if I thought I would go into labor or anything like that, I would have to make sure that the blood thinners were out of my system 24 hours before I gave birth, which I thought was super important. It was kind of scary as well. If it was in my system, I wouldn't be able to get the epidural. So I did get induced at 39 weeks. And the doctor did tell me that if I thought I was going to go into labor, make sure I stopped the blood thinners. So I got induced at 39 weeks and stopped the blood thinners 24 hours before I got induced. When I arrived at the hospital, the process of being induced, I was already 4 centimeters, so I only needed to do the IV. The first time around, I had to do where they put the balloon inside and the IV, so this time it didn't take as long. I actually gave birth from 12 o'clock in the afternoon, got induced, and then by 5 o'clock the next morning I actually delivered my beautiful baby girl. They restarted the blood thinners 12 hours after I gave birth, and we'll be on blood thinners now for another 2 more weeks. She is currently 4 weeks. So that is something for you to look forward to, is to be on blood thinners 6 weeks after you give birth. As I told you before, she is currently 4 weeks, so I do have 2 more weeks left. And I will be done with my first. I did have to be on blood thinners for about a year. If you guys have any questions, please put them in the comments below. I would be happy to answer any questions you guys got. You know, having the disorder while pregnant can be super scary, and I would love to answer any questions. Or next week, I will be talking about my postpartum experience. So stay tuned.